And now we'll move forward to the elbow. Everybody has a relative or has had it themselves an entity called tennis elbow or golfer's elbow. And what that is an inflammation of some of the tendon origins of muscles in your forearm, and I'll explain that to you. This would be a picture of an elbow and the elbow is called a trochleogingimoid joint. And what that simply means, it's a very unique joint in that it has a hinge mechanism, but it also is able to rotate. So you can place your palm up and put your palm down. And that occurs at this bone here called the capitellum. So that will rotate, and this called the ulnar will go up and down in terms of a hinge type of fashion. What doesn't show on this model here, and I'm going to show you here, is what happens on the dorsal surface or on the top of the forearm is there's muscles that take off from this bone, which is called the lateral epicondyle. And that's what you can feel on the outside. And when you go to pick something up with your palm down and lift it up, it stresses this. So they call this tennis elbow because tennis players will do a backhand type of swipe. And what happens is you get tears where that muscle belly starts in the bone. And so as time goes on, it gets worse and worse because these muscles cause you to extend your fingers and extend your wrist. So that's why we call it tennis elbow. Same thing happens on the inside with this bone over here as the muscles go from your inside called the medial epicondyle, and they form flexion, allow you to flex your fingers and your wrist. And on a golfer's elbow, it also tears away from the bone in that area. And it happens when golfers take a swing and hit what's called a fat shot. And as they hit that fat shot, which I hit all the time, you tend to stress those flexor pronator mass, those muscles, and the tear can occur at that time. The treatment is rest usually. Sometimes we do cortisone injections to get rid of the bad inflammation. And on rare occasions, we might need to operate on that. And now we're going to move to the elbow. The entities that we were talking about that are very common entities include lateral epicondylitis and medial epicondylitis, again known as tennis elbow and golfer's elbow, period. As mentioned in the skeleton and also the drawings, this elbow is called a trochleogingimoid joint in that it has a hinge mechanism and it also has the ability to rotate, and this is called supination and this is called pronation. And that allows us all the latitude that we have to reach for things because of that massive motion of the elbow itself. Frequently, this is called the lateral epicondyle, and this patient, if he had lateral epicondylitis, would have significant tenderness for me to palpate this area of the lateral epicondyle. This is where the origin of the extensor muscle, so all this guy's well developed, and all this muscle mass is the extensor muscles that come down and allow him to bring his wrist back and then straighten out your fingers and straighten out his fingers. So people will have tenderness to palpate the area, but more importantly, straighten out your fingers again, don't let me push him down. He would normally have pain on resisted finger extension because these muscles have to tighten up and it pulls at the injured area. The same thing is true of medial epicondylitis, is this little bump in the inside of the elbow, and I showed that graphically before. And this is the flexor pronator mass. So all these muscles flex the fingers, and pronation is to bring the wrist in this position here. So resistance against that kind of motion would cause pain for this patient with golfer's elbow. And it's the same thing as a tear at the very origin of these flexor pronator muscles. The treatment frequently is rest, anti-inflammatory medications, maybe splinting times. The other treatment is on occasion, the area could be injected with a corticosteroid in the hope of settling down the inflammation. And finally, some cases do come to surgery for debridement of the avulsed area and then repair back to the normal bone.